Hi, once more, my dear students. This is the final part of my lecture about normal development. With you is Professor Eman Ahmed Zaky, the head of Pediatric Neuropsychiatry Unit, Pediatric Department in Shams University Faculty of Medicine. For the last time, I declare no conflict of interest. What about the intended learning outcomes of this third part of my lecture? To recognize factors that influence childhood development, to recognize the developmental delay warning signs, and to know the available interventional modalities for cases with developmental delay. What about developmental warning signs? They include maternal or parental concern because of delayed acquisition of some developmental milestones or all of them. They include also persistence of primitive reflexes, discordance of developmental abilities in different areas, and regression of previously acquired skills. Assessment of development is essential. Why? Because they are useful to evaluate the current skills of a young child relative to where they should be. They are essential to identify the high risk for a specific problem from those with global developmental delay. Picking up cases for available, selective, and effective interventions. At school age, it can highlight neurodevelopmental strengths and weaknesses crucial for academic learning. So, we need to do a rapid child surveillance to detect if he is normal or needs thorough assessment. This surveillance concentrate on head control and posture during neonatal period, the ability to use the supine position at 6 to 8 weeks, to sit at the age of 6 to 9 months, the mobility of the toddler during the period of 18 months to 24 months, the ability of the child to communicate at the age of 3 to 4 years. History taking is a crucial cornerstone in assessment. They must lay stress on parental concerns, antenatal, natal, and postnatal events, whether normal or hazardous, family history relevant to development, social history, the intake of any medications, operations, and the presence of any allergies. Developmental history will concentrate on key milestones, temperament and behavior of the child, sleep pattern, eating habits, sphincteric control, concerns in nursery, if any, and previous developmental checks and relevant concerns. Second step is clinical assessments that include thorough observation, engagement with the child in a comfortable, friendly environment with proper safe toys to attract his attention. The room must be prepared to be safe and comfortable, where the examiner faces the caregiver and his eyes are on the child to observe him without irritating him. Establishment of a rapport between the examiner and the caregiver and the child is essential. Also, interaction will depend on the child age and pattern of behavior. We must make the child feel safe and enjoy the task. The detailed developmental assessment of one or four key developmental milestones must be carried out. At the end of our assessment, sometimes we will not be able to satisfy the mother. Some mothers will be uh, very reluctant to accept that their children are normal. And on the other extreme, some mothers will be shocked if you tell her that her child have her child has a problem. So satisfaction of our customers is usually difficult. Questions are guaranteed in life, but unfortunately answers are not. Take home message from my lecture include the ability of the listener to recognize that acquisition of developmental milestones has a range of normality, and the relevance of developmental delay varies from a child to another. Lastly, but by no means least, you must be able to recognize the developmental delay as early as possible. Because early detection of such developmental delay is essential for early and maximum intervention and for parental acceptance as well as the most desirable prognosis of any case of developmental delay. Let me thank you for your attention, and I hope you will enjoy your journey in the pediatric curriculum and get the utmost benefit of your clinical rounds as well as the lectures from the best professors in each subspecialty of pediatrics. Let me now wish you the best of luck.